Okay, so surgeries, primarily arthroscopies, ACL repair, total knee replacements. But are there things that you can do ahead of time if you've got knee pain? What are some of the things besides getting stronger and riding a bike, which I'm a big fan of, a no impact way to strengthen your muscles and get that range of motion? So besides strengthening and doing no impact activities, let's talk about what kinds of injections there are or beyond.
Medications.
Yeah, medications.
Yeah.
I'm Robin Robertson, founder of Healthy Knees Coach and international best-selling author. I figure I was born with a crappy pair of knees so that I could help you avoid the mistakes that I made and benefit from the many successes I achieved in my long and sordid knee history. Fast forward past multiple knee surgeries, ultimately with both knees replaced, plenty of life experience and study into the latest research for knees, and I'm stronger and healthier than I've ever been. I want to help you get there too. I share these lessons with you that will change your knees and probably change your life to give you the strength, stamina, and stability to get back to doing the things that you love. If you suffer from knee pain or want to avoid it altogether, you are in the right place, friend. Let's get started.
So starting simple and least expensive and so forth, Tylenol is a great pain reliever. And it's very safe unless you drink a lot or have some type of a liver disease.
Okay.
So I would tell people maximize your Tylenol first. Again, just to emphasize, be as light as you can be as strong as you can be, and if your knees are getting arthritic, which you'd only know from an x-ray, knock off the impact sports, running, jumping, and all that. So that is a given. Then if you still are having discomfort, Tylenol would be my first line of defense. After that, anti-inflammatories if possible. Again, the risk goes up a little bit because you could, if you have kidney disease, you don't want to do that. Or diabetes, where that could affect your kidneys, you don't want to take anti-inflammatories.
So like ibuprofen.
Yeah, anti-inflammatories would be, the common ones are ibuprofen, Aleve. Ibuprofen is Motrin.
Yeah.
And Aleve, those are the most common ones, which is naproxen or naproxen.
Right, yeah.
Those are the most common ones out there. But there's a whole slew of anti-inflammatories, and some are safer on the kidneys, some are safer on the GI tract, because GI bleeding is a risk if you start taking anti-inflammatories. So I always mention, the anti-inflammatories could adversely affect your kidneys, your liver, and your bleeding, your GI bleeding, or in the brain bleeding, anywhere that you might have a leak.
Yes.
So you got to be careful about that and weigh the risks of that. And and after that, there's meds that are some people consider narcotics and some people not, like tramadol. You may have heard of that. It's kind of classified as a narcotic, though it's not an opioid like morphine and Demerol and Percocet and oxycodone and Vicodin and all those. We try to stay away from those. I would prescribe those if the person's going to have their knee or hip replaced in the near future and they just need some pain relief. They're going on their last vacation before they're operating, and they want to not be suffering too much. I would give them some of that.
Yeah.
A couple of things I didn't mention is heat and ice.
Yes.
Icing post-op is great for pain relief. Most arthritic joints don't like ice.
Right.
And that's why people go south. Older arthritic people go south for the winter.
Yeah.
So, getting in your hot tub, taking a hot shower in the morning to get your arthritic body loosened up a little bit before you get on the bike or before those are good. The other thing we didn't talk about prior to knee replacement is bracing.
Right.
So an unloader brace, I think we tried those on you. If your knee is arthritic and on one side and you're getting bow-legged, a brace that can push you like this and get the weight off the bad side and get it over to the other side, that helps too. So those are a couple of things I just thought about.
And they really do help. They're a little clunky to wear, but I wore one for months before I ultimately had knee replacement, and it did offer a certain amount of relief from that just grinding arthritic pain that can wear you down so much.
Yeah, some people wear them just if they're going to walk the golf course.
Yes.
They want to do that, or play a game of pickleball, tennis, volleyball. I have one patient, both knees are bone on bone. I got him those braces like 20 years ago.
Oh.
He still plays competitive volleyball.
That's
with the brace.
fantastic.
Yeah. So.
Yeah, so ask about that, and check with your doctor, research the options, talk it over with your healthcare professional, and make good decisions that way. Surgery is not always the first thing that you should look at. Of course, you'll be guided by your doc, and if you need surgery, you need surgery. But preparing for it the best that you can by becoming stronger, making good choices. It may be, especially with arthritis, that you find certain activities hurt your knees more than others. And in my life, I had to make that choice to leave running behind, my first athletic love, and to move on to activities that are going to support the health of my knee more. And it opened a door to riding a bike. I've had the opportunity to ride my bike all over the world, and it's pretty fantastic.
And Iowa.
And Iowa!
Yes. Exotic Iowa.
I know.
Yeah.
Okay, what else should people listening know about knee surgeries and pain relief? Is there anything else that you want to add?
Well, nip pain in the bud. Okay, don't try to be a man, and,
or stoic.
You just so I would tell people as their knee was waking up, either from the local anesthetic that I gave, or from their spinal block, or whatever type, as you start to feel that pain, get on top of it, maximize your non-narcotic medicine first, and then titrate in just, the narcotic, because you'll get some either Vicodin or Percocet, which is hydrocodone and oxycodone respectively. You'll get some of that. Don't just load on that right off the bat, because then that increases the chance of nausea and vomiting and constipation, which is no fun. And you'll just be sleeping all the time. So just titrate in the narcotic as needed to be comfortable, not zero pain, but, a 1 or a 2 out of 10.
Right.
Don't expect zero pain, but we all would like that.
That would be nice.
You don't want to be sitting there every day at 5.
Yeah.
5 or 6. And,
I think that's really good advice. With 12 knee surgeries, I tried it both ways of staying away from pain medication because I didn't like how it made me feel, except then I feel like it took me longer to recover because you're battling the pain so much rather than being a little less in pain and allowing to be more comfortable. So,
and if you're laying there in pain, you get emotional, you might be crying, you get depressed. Why did I do this?
Yes.
And that's not good for your recovery. So if you're just a little happy on the pain medicine and you're comfortable enough to do your therapy, that's what we want.
Yeah, that's right.
Not
I think
zonked.
that's not
not falling asleep in your plate of food.
No, not good for anyone.
Yeah.
All right, thank you so much for sharing
fun.
this time with us. I look forward to sharing knee news with you every week. I hope that you'll subscribe to the channel, Healthy Knees for You. I post a new video every Thursday, and I look forward to seeing you again next week. Take care.